baby is something like a parasite in the mother's body.
What does that mean?
Women say after they give birth, then their nipple become black.
What? So when they didn't have ultrasounds, after you've delivered the first baby, put your hand into the womb and feel around for a second baby. To conceive a pregnancy isn't just one single factor.
For women in Singapore who are struggling with fertility, what is the most common issue?
Actually,
No.
We've recently done an episode with Dr. Tan Kok Kwan.
Yeah.
Oh my god, so apt.
We played this joke during the episode.
Sorry.
We got a lot of messages saying how much you guys enjoyed the episode. We decided we must have a female version, right?
You're not gonna believe what my name is.
Now that the pressure increased. So today we have with us one of Singapore's most beloved gynecologists who has been helping women from all ages across issues such as sexual or vaginal health, fertility, pregnancy, menopause, and boobs. I don't know that. I didn't know gynaes do this, but let's welcome Dr. Serena Cole.
thanks guys for having me on the podcast.
We also just found out that she's pregnant. Congratulations! For her friends and family watching this, if you all don't already know, she's pregnant.
Why are y'all digging the dirt on me?
I'm guessing everybody here has a reason to see a gynae except me. So I've never met a gynae before, but from my understanding, a gynae is just somebody that helps with pregnancy for the most part, right? Or what does a gynae do exactly?
So actually a gynae is a short form term for obstetrician and gynecologist. So obstetrics is really childbirth, labor and delivery, follow-up throughout the pregnancy. So yes, you're right in so far as what you said.
Oh, okay.
Yeah, the gynae part is actually more of the women's health part. So the women's health, like the ovarian cysts, the period problems, menopause. So that is the sort of thing that gynae encompasses.
Right.
So obstetricians and gynecologists do both of those things. Obs and gynae, I would like to think are like two sides of a coin in that sense. Yeah.
So then on a day-to-day, what are the most common issues that Singaporean women are coming to you for?
For gynae, I would say, vaginal discharge, menstrual issues.
Okay, since you brought up discharge.
Thank you, Alison, for asking for us.
It's really hard. No judging. This is a safe environment.
It's a topic that I do frequent with my friends sometimes. Because sometimes we always think like, oh my god, our menses is here, right? Then we go to the toilet, then it's just the discharge.
Yes.
And then I feel like
You don't feel your menses every time.
No, it's like suddenly
you feel the water. I mean the blood.
Is it like a lot, then you feel it, or you feel it at all times?
No, you feel a
like
squirt.
trickling?
The first one. No, the first one you feel like the
There was
first
one time I sneezed and my period came.
I think fair that one.
Yeah, but sometimes the discharge, right, feels like the liquid coming out. So you think it's menses, right? Then you go to the toilet, then you realize it's not. And then I feel like discharge, right, is so random to me. It's like, suddenly you thought like, okay, maybe today I can wear a thong, right? Boom! Discharge. Then you're like, oh shit, I feel so unsexy now.
Yeah, same.
Then
Do you wear thongs? Too much information.
I
You got discharge. I mean, tongue normal.
I wanted to ask like, what is like a normal frequency for discharge? And like, is there a way to like reduce this discharge thing? Like, is there a way to control it?
So actually, the normal frequency really depends on the lady's own menstrual cycle. And so during ovulation, when the egg kind of comes out from the ovary, then there will actually be a change in the nature of the vaginal discharge. It actually becomes a little bit more like a egg white texture, a bit translucent, thick. That's
a bit
right.
like pea-side. As in like, it's
You're right.
sticky.
No, you're right. You're right.
When you blow your
it's
nose,
pea-side,
right?
it's like sticky.
Yeah.
Viscous.
Yeah, so a bit more viscous, but you're absolutely right. It doesn't necessarily indicate that there's infection. Like, it could just be normally as part of the cycle. And in fact, some ladies even notice in very early stages of pregnancy that they have increased discharge, but it's a thin, white sort of discharge. More like a bit creamy, a bit sticky.
Okay.
Yeah, but not everybody has these changes.
So in general, if it's like white-ish, it should be quite safe. Like it's healthy. I don't need to go to a gynae for this.
Oh, and also no symptoms. So things like itch, or there's a bit of a smell, there's a bit of an offensive odor around it, fishy smell. So those kind of things can actually indicate
smell,
infection.
right?
But what fish?
I'm too childish for this. Wait, she said fishy.
That's right, fishy.
They say that when a girl smoke, right, then her
Oh my god, I've heard of this.
her vagina will
Yeah.
smell like rotten sotong, right? Or like have like fishy smell and all this kind of stuff, right? Like, does smoking affect the smell of a vagina?
I know of scientific evidence that nicotine, well, I suppose nicotine because the
Yeah.
cigarette smoking causes that,
But
but I might be wrong. It's possible that some individuals do actually have that. But they also say that the vaginal discharge is affected by what people eat. Yeah. So the diet might also change things like that.
So if I eat a lot of sweet things,
I
my
don't-
discharge is
No, meaning
I don't
what I'm
think
hearing
so.
is that because culturally we all eat different foods as a norm. Meaning in your professional work experience, culturally they smell different.
To begin with, I don't smell my patient's vaginal discharge. That's what you're asking me.
thank you for clarifying.
That's good.
But what if you say, doctor, my discharge is a bit fishy. Here's the sample. Then
Sample?
how?
Yeah.
Like maybe
Yeah.
I'm wearing something to like a panty liner.
Like, is this smell normal?
Yeah. Then
You know what I mean? It's a
how?
perfectly good question to
Yeah.
ask a doctor, what, right?
Yeah.
So
then
I don't think patients really like bring a sample of the discharge
see,
lah, but
yeah.
they do complain that there is that kind of fishy smell. And then, in those situations, I'll just do a swab test, take some of the sample and send for testing. And typically that fishy odor is bacterial vaginosis. So that's a condition caused by overgrowth of the normal bacteria in the vagina. And the bacteria is called Gardnerella vaginalis. So, that can very easily be treated with antibiotics, the course of antibiotics. And this sort of thing is pretty common during pregnancy as well. So, a course of pregnancy-safe antibiotics for a week should settle the issue.
I actually heard that like alcohol and coffee, right, is like it will dehydrate your vagina for some reason and then therefore make it like smelly.
Oh, then same as nicotine, ma, which dehydrates you.
Well, it also depends on whether you are hydrated or not. Lor. If you drink alcohol but you also drink a lot of water with it, then you won't be so dehydrated. Same for coffee as well.
But if I'm going
Yeah.
straight home from the club, and then for people who might need to know because they're going straight home from the club with a man,
Oh, I don't know about that.
Which is where a lot,
done.
which is a lot where a lot of smell discovery happens.
people say like after sex you have to go and pee, if not you get UTI. True or false?
So some ladies actually notice that they tend to get urinary tract infections after intercourse. Only after intercourse. That's the only thing that somehow triggers the UTI.
Is it penis dirty?
Oh.
Not necessarily. I don't think so lah. I mean, sometimes it's just digital penetration as well. What? But
Digital.
use finger.
Oh, okay.
Oh, because digits, yeah, went through this last week.
So I think it's postulated that because the lady's urine tube is a bit shorter and also quite close to the vagina, so during intercourse, sometimes there can be some transfer of germs as well lah. So because of that, the germs can actually enter and cause urinary tract infections. So some ladies who have it really quite bad, they can even feel so uncomfortable that they have to take prophylactic antibiotics. So that's after they have intercourse, then they take 1 dose of antibiotic just to make sure that this is cleared and they won't develop a urine tract infection afterward.
So I can take Panadol? Like, does that work?
Panadol is not antibiotic. Nah.
Oh.
It's just a painkiller.
Listen, what the fuck is that
I
question?
don't know. No, like I feel like if got any trouble, I like Panadol. So I thought it was antibiotic. No, it kills germs.
No.
No. Oops.
It's a painkiller, blood thinner.
Oh, I see.
Yeah. Anyway,
Like, they say like girl can squirt, right? But then when girls squirt, then they don't know whether it's coming out, as in they don't know whether it's urine.
What is coming out? lah?
Yeah, what is coming out when like
Why does it
in
matter?
squirting? What do you mean?
everybody involved is happy about what's coming out.
But like, it's like peeing onto my hand.
Yeah, you feel insecure.
But
Yeah.
what is
Is
squirting?
it weird to ask if you have attempted?
So not all ladies actually squirt during intercourse.
Right.
And so squirting actually is fluid that's coming out from the urethra, which is the same passage where pee comes out from.
We're okay with that. On behalf of men.
And some of the fluid actually contains like urine components, but some of the fluid is actually like lubrication, which comes from these little glands called the Skene's glands. So it's something like lubrication is
which is
lube.
at the clit.
It's lube as well as pee kind of mixed together. And that's why it's so much more than if it was just lubrication, right? So that's why it can even come out at such force. Almost like an ejaculate, but not quite.
It's coming out from the what?
The pee hole, lah, the urethra.
Have you heard of those like wives' tale? If you're trying for a baby, then after you have sex, you should lie there for like 10 minutes.
Oh, yes.
You
This is
recommend
30 minutes. Is what
30
you read,
minutes?
Some people say 30, some people say 20, some people say 10.
Okay.
So I think this is one of those things that's like a bit of like an urban myth. If you look like anatomically, most of the time, the vagina is actually angled slightly downwards. and then the uterus is often angled slightly upwards. So it's anteverted.
What does that mean?
Right.
So when the vagina is angled slightly downwards, okay, what happens is that when during sex, the sperm is deposited in the vagina itself. Naturally, if she remains in a lying down position, then the sperm will just flow by gravity towards and pool at the neck of the womb, the cervix.
Right.
So it pulls there.
So she's doing a headstand.
No. So if it pulls there, that's fine, you know,
It's a
and she's
good thing.
lying down. Yeah, it's a
Yeah.
good thing.
Oh, okay.
Yeah, and then of course, even better if the lady is having an orgasm, because during an orgasm, it causes like a contraction. So what happens is that the neck of the womb almost sort of dips into that pool of semen and sort of sucks the sperm up and draws it upwards into the uterus.
Like a vacuum.
Yeah, something like a mini vacuum.
This changes the order of sex.
What do you mean?
Meaning you should first allow a male deposit. You know what I mean? Like as a conservative Asian male, right?
Okay.
With good upbringing, yeah.
Okay.
We are taught to first service
Yes.
the female. Then only when she is done are you then allowed to be done.
Yes.
So medically, we should flip it.
So he's saying that once the sperm is deposited in the vagina, then she
yes.
comes.
Isn't the optimal for it to be at the same time?
Together.
Also, it's like choo, choo, choo. Is it the
Yeah.
It's like
One thumb, one pull. One push, one.
Oh, these sound effects.
The mochi.
Super coordinated.
So the female orgasm has a function in that sense also.
Biologically, yes, it does.
I'm so confused because I thought you're pushing out liquids. So I thought it's like spitting away.
Yeah,
the
that's
sperm.
what I thought also.
I didn't know it's a pull back.
Changes things.
Are you trying for a baby?
Nat, you have something to tell us.
She's trying to naturally not conceive and then now she realized she's doing the opposite.
So to answer your question, I think, you know, in a way, there is some basis for asking the lady to sort of remain in a lying down position.
Okay, so then what is the optimal amount of time that the woman should like lay down?
There isn't really an optimum time there. Yeah, so there are ladies who don't lie down at all and they just immediately get up, but they can still fall pregnant.
Okay, but the
And-
orgasm damn hard lah, is it?
Oh, very long. So it keeps.
Oh yeah.
It might not though. Yeah.
Is it actually, if the guy ejaculate damn hard, right? Does that help?
It also depends on the quality of his sperm. So you see, that's why I'm trying to say that, you know, for fertility, you know, wise, okay, I mean, to conceive a pregnancy, it isn't just one single factor, like he ejaculated very strongly. She's definitely going to get pregnant. It isn't. It's the right time of her cycle. Has she ovulated yet? Is her egg ready and waiting to be fertilized? What's the quality of his sperm? You know, in the womb, are there any problems like fibroids or polyps, growths that might sort of, you know, be difficult for implantation of the embryo to occur? You know, yeah. So there are so many things. The egg quality, depending on the mummy's age, the lady's age. So all these things sort of contribute. So it's really like many, many pieces of the puzzle. And when everything aligns, then fertilization happens. And this actually also matters for certain couples who actually have difficulty. So they have a condition called vaginismus. So it actually hurts when he tries to penetrate her. So because of that, you know, if they're trying for a baby, some of them will actually resort to what's known as a syringing method. The syringing method is the guy will actually ejaculate in a bottle and then syringe up the sperm, draw the sperm up into a little like 2 or 3 ml syringe that it can be bought over the counter at pharmacies. And then she can actually just insert the syringe inside the vagina and deposit the sperm in the vagina.
How close
And
is
then
that?
orgasm.
Exactly.
Yeah,
And then orgasm.
to increase the
chances.
sucking in of it.
That's
lah.
right.
Wow.
Yeah.
How
Like-
close is that to IUI procedure?
Oh, IUI is different. IUI, for those of us who are not so familiar with it, it's called intrauterine insemination. At the start of the cycle, we actually give the lady some medications in the
Okay.
early part of her menses to help the eggs to grow and mature. And after that, a trigger injection is given to help the eggs to mature even more. And then only at the right time of the cycle, which is determined by ultrasound, okay, then we actually take a sample of hubby's sperm, go to the sperm lab, the andrology lab, you wash it, spin it into a pellet, and we put it all the way into
Spin
the
it into
womb.
a pellet. Wait, hold
Spin
up.
it into a pellet.
Spin it?
Yes, that's
Why do
right.
you use that word?
Well, it's called centrifugation.
Oh,
lah.
so
That's
you
a
literally
scientific term.
spin
You
it?
spin it into a pellet. That's right.
sperm-
Sperm washing, spin it, and then you put it into the womb. So the location is completely different. Unlike
Yeah.
normal intercourse or syringing method, where it's just deposited in the vagina.
So the stringing is kind of simulating a very long penis lah, basically, or a very strong jet.
No need to be a very long penis lah.
okay.
The syringe is probably about the same length as a
very strong jet.
or maybe a very
Right,
strong
right.
jet. I don't really think you need the
it's really the
force
motion of the ocean. Instead of the size.
So size
Is that what that phrase means?
No, not even things like that, but it's about the waves.
the tsunami.
I need to Google this.
Size doesn't matter when it comes to fertility.
Yes, that's right.
I'm sure it matters a little bit. Like fucking, you know what I mean? If it's like a little, if
But
it's like a
the
little
syringe can do it. You can do it.
Oh yeah,
Yeah, the
No,
2 to 3
because
mil
that
string.
the guy come into a cup, you say, then syringe it up, right? There's a myth that when sperm is exposed to air, that it will die.
Yeah, so you don't leave it for too long. It's true, you know what you said.
Oh, okay.
no?
Wow, yeah.
So if you leave the sperm for too long,
Good for
like
you.
in an aircon room or something, it's not room temperature anymore. Yeah, so
Or
the
body
sperm will
thing,
actually, it's not body temperature anymore. So it will actually, not.
So it's a
such
special
high
cup
quality.
and a special
No
syringe.
lah, just a normal container.
So my
will do.
my morning coffee cup, there,
Wash it first.
or after.
It
lah.
shouldn't be like such
Oh,
a
yeah,
hot
okay.
coffee, right? Your sperm can
Okay, so
fry.
any cup, but the syringe is a special syringe.
It's just a normal.
Over the
Okay.
counter.
And you must like
syringe.
fast give. Oh, okay, okay.
Yeah.
How does it feel like to be pregnant as a gynae? Do you think you are more assured or you are more worried about the more risk and the more things
So
that
that's
could go
interesting. I think some people said that, like, will it be like all the terrible things that could happen and then you get very worried about it? I think for me, I'm quite chill about it in the sense that, yeah, whatever will be, will be. I know that there is a certain limit to which interventions can help, but comes to a point where, everything's really just out of my hands. You can't micromanage or control everything.
Do you go to your friend who is a gynae, or like actually do gynaes not like to find their friends to do this?
No lah, we'll definitely find our friends lah. I think somebody that you trust, somebody that you know and you're comfortable with. I think that's what, in general, most ladies would want to have from their gynae. Anyway, my gynae is very nice.
Shout out. Can't you do some checks yourself?
Like your dilation.
Yeah, I would think like you can do your own ultrasound or like I don't know. I heard there's some probing things.
I don't think I do probing for myself.
Oh, okay. I don't know. I feel like
clear.
That's called another name. Well, not appropriate. This is a family show.
But I do my own ultrasounds
I
from time to
see.
time. I think it's just for self-reassurance. It's one of those things lah.
But
Yeah,
is it
I agree,
not
I agree.
awkward like your friends see you're down there,
Like the whole office saw you're down there.
Not the whole office, just my friend.
Because there'll be the nurse, right?
That's right, chaperone lah. But sometimes if you don't really need a chaperone, it's okay lah. I trust my friend enough not to have a chaperone.
Wait, the nurse is known as a chaperone.
That's right.
Like they are there purely as like, I mean not purely lah, but like to also be a third party to make sure nothing untoward is happening.
Yes, that's right. In fact, even in all sorts of clinics, not just gynae clinics, even in like general clinics as well, they do recommend to
But
have
when I
chaperone.
went, don't have
I mean, it's ideal to have, but if don't have, also okay.
Maybe
lah.
I buy the cheaper package. I don't know.
Oh, don't
No, you
say
sign the
that.
indemnity.
Mine was
You cannot sue
alone.
us.
Oh, yeah. Okay.
Most of the time, I think the male gynecologists are a little bit more careful about having a chaperone during the examination. But I think
makes
for
sense.
female gynaes, same thing lah. Overseas, they've actually been situations that have arisen where, patients have accused the female gynae or male gynae of some things happening that shouldn't have happened, So that's why I think having a chaperone is always a great
Right.
idea.
So my wife and I just did IVF. So my wife is like highly like drugged up right now. Is the only way I can say this, right? Because I think when I Google all the medication, there's just everything is progesterone. It feels like 80% is progesterone. She's eating it. She's self-jabbing it. Self as in me and
Okay.
sometimes her.
Jabbing at home.
Yeah, in the belly. And then there's the vaginal insertion. We're doing all that and like multiple times. And after that, there is this other drip, like this lipid injection thingy, where I went to read the ingredients, got like soybean milk.
Huh?
And then I'm like, what's going on? Because the whole thing is white. It looks like coconut milk.
Injecting into her like blood.
Yeah.
Oh.
It's so strange. So I would imagine her, her body's like, yo, why are we pink today,
It's like air bubble cannot go in, but soybean milk.
Soybean.
Yeah, so what is that?
So intralipid, you're absolutely
I think
right.
so,
One of the
yes.
components is actually soybean. I would like to just preface this all by saying that the realm of fertility is a bit like cooking. So, if you go to different chefs, they can make the same cake, but they put different ingredients inside.
Right.
And so some people will say, oh, you using this, French cake flour or something is completely useless. It doesn't change anything, in terms of the product. But some people will swear by French cake flour for their cake, something like that. So, of course, in medicine, we have evidence-based medicine. So some people will still say, regardless of the studies that are supportive of intralipid, some people will still rubbish it, but some people say, doesn't matter. I tried it. My patients got pregnant. I'm sticking with this stuff. So intralipid in some studies actually said that it helps in terms of decreasing the risk of miscarriage. Yeah. So just thinking like how, like if you have a very small preterm babies, you give them like lots of high quality milk, then, they do better. So something similar to that.
No, I'm just surprised we are not making my wife drink it. You know what I mean? Because it's all food. It's like
What is it? What
Bro,
is
got
it?
egg, the ingredient got egg.
No, but
Yeah,
what is
yeah,
it?
yeah,
It's
correct.
actually food. It's a diet.
No. This is actually given intravenously through a drip into the blood circulation of the lady. Yeah, so it's complete soybean. Correct. It's a cocktail of vitamins, soybean, all
Half
that.
the
Yeah.
things like food,
And fatty acids. Right? Yeah. Which is actually, if you think about it, like milk itself is a suspension of milk fat globules, right? It's actually little round spheres of fat.
Right.
That's how like babies don't even need to drink water, don't need to eat anything, they just drink milk. So it's very, very sustaining, strong amount of...
That's why it's a lipid.
Yeah, that's right. So that's why it's intralipid.
Lipids are fats
Yeah.
molecules.
And then progesterones, of course. So your wife is having a lot of injections, a lot of tablets, inserts, gels, that sort of thing. So ladies who go through, fertility treatments definitely I take my hat off to them.
So
Respect.
if I am pregnant, should I drink soybean milk?
No, I don't think drinking more soybean milk really helps in terms of, like trying to sustain the pregnancy.
Try.
No, but I thought it just makes your boobs bigger.
Yeah, I heard men drink too much
Soybean
soybean
milk.
milk. You have like men titties.
Is it
So
true?
expensive. I used to love it growing up.
Hey, don't look His eyes up here.
Why you look at his chest? So I think the reason why people say that sort of thing is because soybean milk actually has phytoestrogens. Any soybean product really, be it tofu, tempeh, soybean milk, your beancurd.
老板.
Lao pan,
It's not really soybean.
Yeah, so the phytoestrogens are
knows more.
supposedly, but it's very, very hard to eat so much phytoestrogen until, you have
perfect
the
Right.
boobs. Yeah,
I
so
see.
I don't
Papaya.
think
Papaya milk.
papaya shouldn't.
Oh,
really-
what about pineapple? I heard, no, not to make your breast bigger, but pineapple, like not good for when you're pregnant.
Oh yeah, I know
that
Stupid the movie.
true?
Higher risk of miscarriage
Why,
or
ah?
something.
So culturally, that's something that has been, in like grandmother stories, they will tell you this sort of thing. Not really been studied before, as far as I'm aware, but I do tell ladies who are pregnant, since this is the case, don't go and eat pineapple, just stay away from those things. But I still have some ladies who said, well, they had very bad craving, they ate a pineapple, nothing happened. So like I said, it's not one of those things that if you do it, definitely something bad will happen.
Well, I'll be so stressed if I have a really bad pineapple craving while I'm pregnant.
No, and then you eat it. Then I'm like, huh? How little self-control do you have?
Is there a scientific explanation for the specific types of cravings that women have when they're pregnant?
It's just something that is triggered in them during the pregnancy. Some ladies find that the cravings they end up craving food that they completely did not like to
Yeah,
eat
yeah.
pre-pregnancy. Then they're very puzzled, like why.
Is there any signs to why the body craves certain things in terms of, is the baby communicating with the mother that I need more sodium, for example, hence I like more salty food, or like we have too much sodium, can you like...
No, not really. Not really. In a way, the baby is something like a parasite in the mother's body. Whatever the baby needs, the baby will just draw from the mother.
Oh, he doesn't give a shit lah. Okay.
So that's why in other countries that are like, where third world countries maybe, or they're undergoing famine, the babies can still be born, no issues, but
The mother
the mother suffers because everything comes from the mother's body.
Wait, then whatever you are saying is right. So because it's taking more sodium, then therefore the mom was like, I want to eat something salty to replenish my sodium.
But if mummies are low on calcium, not everybody wants to start drinking a lot of milk or something like that to top up their calcium
right.
I
levels.
remember when I was pregnant, then I was like, oh, how much should I eat and all? But my gynae was like, you don't have to eat so much because the baby is only taking very, very little from the mother.
But then why people say
Yeah.
the pregnant women always hungry, then people say, oh, you're eating for two, you know? Like, not true.
I think the eating for two thing is more like a old grandmother tale.
Then my grandmother keeps saying a lot of things.
Yeah,
man.
what is
But
it?
Pat legit eating a lot, making me very hopeful. So we're saying she's just eating.
In essence, what the shit?
But it's still a good sign. It's still a good sign.
No, every time I see her, like she's a bit hungry, I'm like, what do you want to eat? Let's make this happen.
So what kind of cravings do you have?
I didn't have, okay, I would say one very particular was Coke. I
Easy.
know it was very, very
What a
bad.
convenient craving.
But
As in
I
Coca-Cola.
I had to drink like at least one Coke every 2 days.
Like Coke Zero can?
Then was like, hey, you got your GD test coming up.
What is GT?
The gestational diabetes. So it was around like your 27, 28 weeks. Then you have to test for it. Then I was like, never mind lah, it's okay. But I really wanted it.
I like how Dan's headspace is just he's optimizing for the test, not the pregnancy. What is the matter
Words
with
of
him?
affirmation is system language.
He wants the doctor to tell him you're fine.
Because if you have GD, then your diet also changes. Yeah.
No, but it doesn't matter after. Like it's like he's trying to indeed after the test, then you drink.
You want to impress the doctor? You want to impress the doctor?
Yeah.
I say, good. Then he like, okay, drink.
Yeah, but so I just drink.
Did the craving go away after?
No, then towards my last few weeks, before I gave birth, I was craving for durian.
Easy.
So my mom just kept buying durian for me.
Wow.
Then I just eat. That's why I think now Ollie a bit like, wow.
Only I got fat.
No, like he
gong ah?
Oh, he buff ah.
very painful. Yeah.
Oh, his
So you need
spike
to
is
train
as
him.
spiky as the
Yeah, so I
durian.
ate a lot of beef also because Dan kept feeding me
It's
beef.
protein.
Yeah,
That's
because I had
protein,
low like
Yeah.
platelets. So the my
Platelets
doctor,
come from beef.
no, I
No,
need to eat
red
a lot
meat.
of iron also. Yeah, I had a lot of iron pills I had to take. So I just kept eating beef. Then it's like eat beef.
You lucky, you know you eat horrible things. You never crave anything bad.
No.
What about like the opposite? Like things that you cannot eat. For example, they say like sushi you cannot eat. Right?
I
Sashimi.
abstain. So
What-
then also abstain with.
So I had a friend that was pregnant like before, and I remember her doctor said if you want to eat like sashimi or whatnot in Singapore it's okay because our food's quite safe. We're afraid of it's the parasites that's often in raw foods you find around the world. But in Singapore it's generally okay. Hence go for it. However, Pat was warned to avoid raw food. So
Yeah.
what's the take
So
on
and
that?
then of course we read about this supermarket chain that is pretty well known that has sashimi and they found some worms and parasites,
Yes.
right? Or salads, for instance. Some ladies say, I never liked to eat salad before pregnancy, but now I love it and salads are raw, so they actually have to be a bit careful with that. It's hard to say, but in general, we do avoid raw food during pregnancy just because it's very hard to be absolutely sure that it's safe. If it's raw food, was it refrigerated properly? Was the cold chain intact? So that's one of those things that
So
it's
the
very hard to
the parasite thing in Singapore being relatively safe is true. It's just that we cannot confirm it is 100% safe. Is it?
Yeah, so we'd rather just err on the side of caution.
I see.
But then in that case, then like soft boiled egg I can eat or cannot?
Huh? Because of listeria. So, yeah, so listeria is a nasty- Sounds like a pretty girl's name. But it's
Like diarrhea.
Like
is what I always
chlamydia. That's just Claudia but longer. Ma.
So it's a very nasty bug that can cause a lot of problems for the baby. It can also cause miscarriage, small baby, stillbirth. Yeah, so because of that, we do avoid soft-boiled eggs, eggs Benedict, all those things during pregnancy. And of course, the other thing that a lot of ladies are not really aware of is soft-serve ice cream. So not those kind of hard kind that you like dig from the freezer,
Okay.
you know. Yeah, it's soft-serve ice cream because that's actually stored at slightly higher temperatures of about 2 to 3 degrees. And if the soft-serve ice cream machine is not washed properly, listeria can actually grow there.
Right.
Like
Yeah.
certain fast food chain.
Yeah.
So it survives in that temperature.
Yeah, it
right?
survives at
I
the
see.
temperature. Smell aversion is also very common. Shampoos, smell aversion to the shampoo, to foods, to, you know, the laundry detergent.
I've seen on TikTok where like during the childbirth, right, then the nurse have to go and like hit the, I don't know whether it was her back or what, but then they say that this is part of childbirth that nobody really talks about.
The part that surprised me is how much the midwives or the nurses help in the pushing. And it's very aggressive. It's more aggressive than my female friends.
Perhaps
expected.
that's what I'm talking about.
Yeah, that instead of like, it's like push and then we teach you how to push, right? There's someone at the top that's trying to toothpaste the baby out.
Yeah.
Yeah, but not hit lah, but they just
Sorry,
toothpaste the baby.
My recollection fails me.
So that's called fundal pressure. Fundal,
Nothing
referring to
fun about
fundus.
it, yeah.
Fundus is the top part of the womb, the most highest part of the womb. So when you apply pressure, it supposedly helps, the mother as well. So when mummy's pushing, using her own core muscles to sort of push the baby out, then there's additional pressure. So sometimes that can actually help if mummy is quite tired or if the baby is quite large. Yeah. But having said that, there are risks. There have been cases whereby the pressure applied has been so much that it even caused like bleeding from the mother's liver or something like that. So that was obviously not intended lah. We just intend to help mummy to achieve a natural delivery.
My friend described as she felt like her push did nothing because she was been pushing, and then the fella come and toothpaste her, the baby just shoot out. So it's like, why you never come sooner?
I was a clamp baby.
Forceps.
What's a clamp?
Sometimes the baby cannot come out, then they're trying to help. Then apparently got two methods. Either use the vacuum or like you
my
clamp. So then
God.
they clamp me a bit to help me. I was a big baby.
Did your head have it?
I was like 4.2 kg.
Wait,
Very big.
Thank you.
I don't know what's normal.
Get asked me about big baby on the table.
I have a question. So because for ladies who have done like C-section, right? And if they do get a second baby or so and so forth, like they want to consider having a vaginal birth or so. Is that possible? Yeah. What are the precautions that they have to like take note of?
Yeah, that's a great question. So a lot of people actually are very keen for a natural delivery after having gone through a C-section, because some ladies actually feel like it's almost like a disappointment, or sometimes they even feel like mom guilt, like a failure on their part that they weren't able to achieve a natural delivery, which isn't the case. I think it really depends very much on what was the reason why she required a cesarean section in the first place. If, for instance, the first cesarean section was due to maybe the baby being in a breech position, head on top and bum down, okay, that's different. Then there is a chance that she, good chance that she may have a natural delivery in her second pregnancy. If let's say it was in your situation whereby it induced and it was in labor for quite a long time, but the neck of doom didn't quite dilate to 10 cm, the labor didn't progress, it was too long already, then, as having to have a cesarean section, then there's lower chance that it would be successful trying for natural delivery.
Right.
And of course, there are other reasons as well. So for instance, some ladies, not so commonly, they have abnormalities in their womb, then we would just recommend second cesarean section.
Why if the baby is feet down or butt down, why is that such a terrible thing?
Because remember, I mentioned earlier that the largest part of the baby is actually the shoulders.
Shoulder.
So if the rest of the baby's body comes out and the shoulders get stuck, and the head of the baby gets stuck inside the womb, that's very, very dangerous. And there are maneuvers that have been done and taught over the years to try and disimpact the shoulders and deliver the baby's head. But it isn't always so easy. And even with those maneuvers done in a very timely manner, there's always a risk that there's not enough oxygen going to the baby's brain.
Right.
And brain damage can occur, which is just really not an acceptable
Is there no
outcome.
way I can like massage to turn the baby to correct?
You can. So actually what you're mentioning is absolutely right. What we do is we use fingers and try and disimpact and push the shoulders away and turn it in such a direction where the diameter of the shoulders is a bit lesser
During
the labor itself. Like as the mummy is
As in, you
How hard
put your
are your
hand
fingers?
inside.
yes,
How high up are your fingers? Like you're at this point, you're inside already.
no, into the vagina. So just at least up to about half of the palm or midway of the palm.
Oh, and then you feel the baby already.
Yes, you can.
No, because
use
the
your
baby
fingers
come out through the cervix.
push the
already.
shoulders away.
rotate.
Yes, so it's a rotation.
Yo.
So you're the baby's first touch of the womb. You're like,
No, you touch the mother first. So at point of birth, right? Usually you will see
He's so stunned.
they immediately try and distract the father and say, "Daddy, come and count your fingers and toes," right? I feel like there's a ruse lah, because clearly anybody can count fingers and toes and you don't need the father to do that, right? What are we distracting the father from?
I don't really think that we are actually distracting the father per se. It's that we also want daddy to be involved in the whole experience.
Pity lah. Okay,
really don't
like
need
hey, look, you did something like that lah.
Wait, but I've heard of the kind, right, where they recommend the husband not to look because they say that like during the childbirth, there are husbands that faints.
Oh.
Like they will
No,
faint
or
because
rather,
they're scared.
when people see the bloodied vagina, then that changes. Then the vagina is no longer like sexy to them. So you look at it and then you think of it as a mortal wound.
A long time ago, I actually had one lady who, whose husband was present when she was pushing, and I was present. Nurse was there as well, and then suddenly husband just fainted, and he fainted very quietly. He just slips down and landed on the floor.
I want to tell you Jackie is like that. He take his own blood. He will just tell the nurse, later I see my own blood, I will faint, just leave me be. Then he will just take blood. Then he will just...
Oh my god.
So sad. Sorry, please go on.
So the lady actually just looked over the edge of the bed and said, "Oh, he's down," she said. The nurse went and attended to him while I continued pushing with the lady. So after that, he was quite a large guy. So I tried to sort of pull his legs downwards a little bit because his whole head and shoulders was against the cupboard.
Oh no.
Talking about the babies, yeah.
The man.
I'm like, where am I?
Stop furnishing.
So you had to stop with the delivery. and
Yeah, I stopped
attend
for
to
a
the
while.
husband.
Yeah.
Damn.
And then when I pulled his legs, then he sort of slowly woke up. And he looked around and he was fine. Yeah, so we finished the delivery, natural delivery. Mommy
my
was very happy. She would not
How
let him
did he
forget.
feel about himself after that? Like,
yes, yeah.
I didn't ask him lah. Don't embarrass the poor daddy lah.
right.
Then paiseh,
Yeah.
Imagine you
not
wake up
only
and she
were
say,
you,
"Hey, you scared,
not a part of it,
Yeah.
you literally took the doctor's time away from
Yeah.
He's like, Daddy, want to go and cut? Never mind, I cut myself.
Have to disinfect his shoulder from the cupboard.
Unreliable man.
So if say it's an emergency C-sec, like the baby got stuck halfway through coming out of the birth canal, then I cut open and I pull the baby out through again.
You can, but sometimes if the baby's head has traveled quite far down the birth canal and is quite deeply impacted, it can be very difficult to deliver the baby through the cut on the abdomen because the baby is already so far down the birth canal. You literally have to sort of scoop the baby's head up and out of the pelvis and out into the abdominal incision and deliver the baby from there. So that can be quite difficult sometimes.
Sometimes.
Whoa. Wait, so there's no case where like the head already come out and then the shoulder stuck. Then I do an emergency C-sec.
If the head has already come out, like I said, probably the safest and quickest way to deliver the baby is to rotate the shoulders and deliver, which is something we mentioned earlier. But there have also been described a maneuver called Zavanelli maneuver, which is basically pushing the baby's head back into the birth canal and going for a cesarean section to deliver. But that obviously spends a lot more time, right? Because you have to push the baby's head back in, you have to arrange for the theatre to be ready and then rush to theatre to deliver. So time is of the essence in these situations because we just want to deliver the baby ASAP and decrease the chances of lack of oxygen to the baby's brain.
Poor thing the baby is like, you come out of it, then you like, nope. Someone physically just pushes.
Oh, okay. And then after the baby
okay.
come out, then they say, right, if the baby never cry, is a problem. Is that true?
Yes, so sometimes there are secretions like mucus, or like a bit of water that's all stuck in the baby's upper airways. So usually we'll stimulate the baby, rub the baby's back, rub the baby's feet. I know there's this like meme or something, obstetricians will beat the baby's backside to get the baby to cry. Yeah, well, basically just stimulating.
Is there truth to that?
These days we're not so rough with the baby lah.
So last time.
They get a child abuse. I've never hit a baby's bum before. Yeah, but I mean, when you stimulate the baby, then generally baby will cry. But sometimes, what happens, baby doesn't cry. And that's a concern because at the time of birth, there is actually a structure in the baby's heart called the foramen ovale that will actually close.
Called the what?
The foramen ovale. And it will actually close. And when that closes, the baby takes its first breath and cries. So if that doesn't close, then there's a little hole in the heart which is considered normal. But it should close. If it doesn't close, then that's a problem.
Oh.
Yeah. And some babies, if they continue not to be able to breathe, they can turn blue and they will need oxygen supplementation and maybe even need to go to special care.
Right.
Yeah.
So when they say some children, they say that I have a hole in my heart, it's because that hole didn't close.
Not necessarily. That's a different kind of hole.
Oh.
That's a septal defect. Yes.
I want to ask about the husband stitch.
Oh,
Is that a real thing or is that a movie thing?
It is a real thing. And I think in the West, there have even been some concerns about consent for the husband stitch. So for those of us who are not so acquainted with this terminology, it's usually when a lady has a vaginal delivery and either she has a tear down below or a cut is made. And the cut is called episiotomy. Sometimes some ladies themselves ask for this stitch. And the stitch is actually supposedly to help to tighten the vaginal opening so that after the delivery, when the couple resumes intercourse, then it's supposedly helps the husband have more sexual pleasure
You just tighten the
during
vagina,
penetration.
right?
Yeah.
How you know this term?
I watched it in the movies.
Oh,
And so like, but I've always wondered if there was a cut,
which movie?
then you stitch up the cut, okay,
Okay.
right? But if you just stitch up more of it, it bonds together, man.
So, after a delivery, okay, the tissue is quite soft, friable, it's a bit bloody as well. So when you stitch it up together, it will stay and there'll be
Right.
some scarring as well.
And
You should
this thing
keep
is
the tissue
allowed in
together.
Singapore.
If the patient herself requests for it, then I don't think there's an issue lah. And of course, it also depends to the extent, of how much you want to stitch it up lah. So actually, overseas there is something called FGM, female genital mutilation, whereby in very rural parts of Africa, India even, when the child is when a girl is prepubertal, they will actually put a stitch already. And they will actually close up the entire vaginal opening such that it's all the way up to the urethra, which is the urinary tract. And that is supposedly, for her eventual husband to, have more pleasure during the initial penetration lah. So in a way, husband stitch is
That's punching
kind of
through,
like, that's right. It's somewhat of the supposedly civilized society's interpretation of FGM. So for feminists' version of it, this is FGM and it's absolute no-no. But some ladies actually request for it. So really,
But
Is there the opposite where the thing tear until rabak already, right? But I know I'm going to have another kid ASAP, right? So I leave it like looser.
Bro, I have a friend that did that.
Like leave it open a bit bigger so it's easier ma. Then don't have to go through I stitch up that tear again,
I had a friend that during her pregnancy, she inserts this like balloon thingy. I mean, it's a proper device. It's not her fucking, yeah. So then she inserts the balloons and then she pumps.
Wait, isn't your friend just net?
No.
You did that?
No.
Oh, no.
I didn't. But it's to open up your.
And every day she just pump. Then I asked her like when it was delivery really like a fart. Then she said like really like
The
smooth.
opening. So they use the balloon to.
It's not the opening. It's I think like right inside the opening, right? Just after the opening.
So two questions here lah. So to answer your question, the purpose of stitching is actually to stop bleeding, to avoid all the layers being just left open and it might get infected.
Right.
And then bring the layers together again so that it doesn't heal in a very scarred or very jagged looking fashion. So I wouldn't suggest that a lady who has quite a bad tear during a childbirth should just leave it there and just let it heal naturally and not stitch it. But to answer your question, I know what you're talking about. It's actually called EpiNo, EP516. So that's actually a little balloon and you can actually squeeze the pump, and then as you squeeze the pump, it's like a balloon pump lah. Okay, the balloon will inflate. So what happens is that you actually put the balloon inside the vagina, so just beyond the opening itself, and usually pump it up to maybe about 3 cm or so, and then after that, as she's more comfortable with it, she doesn't feel so stretched out, then she can increase the
How do you feel about that as a doctor? Doesn't that, like in my head, it sounds really risky, right? Because maybe we are super early stage now and you're just afraid of the baby fallout ma. Now you're just making the hole so big.
So EpiNo is usually advised only for use in the late 3rd trimester. So just a few more weeks before delivery happens, then they do that. And some ladies, in Singapore also are very worried that using such devices will trigger early labor or trigger premature contractions because of the stretching of the skin.
That true?
Which hasn't really been validated. And in fact,
Right.
in the past, I actually wanted to do a research study on this in the previous hospital that I was at. But a lot of Asian ladies didn't want to take it up because they weren't comfortable putting something inside the vagina during pregnancy and sort of like just doing this at home sort of thing.
Yeah.
But there is one intervention that has been proven scientifically to sort of decrease the chances of tearing during a vaginal delivery, and that is warm perineal massage. So just using like a very soft flannel towel with warm water and just massaging the perineum, which is basically the area below the vagina and just above the anus. So that area of skin.
ABC.
It's
Wait,
Dan's favorite part.
how does wait? I want to learn. Is it very explicit to teach us how to do that massage?
So you're just using the towel itself and just applying pressure with 2 or 3 fingers at the perineum area and just going in circular motions.
So the perineum is between the end of the vagina and the anus.
Upper part of the anus. That's right.
The upper part of the anus. What do you mean the upper part?
If
The anus.
If a lady is
anus
lying
lah,
down
right?
with her legs apart,
We
the
press
place where the urine
in?
comes out is the topmost. In between will be the vagina and the bottom will be the anus. So
Yeah.
the area between the vagina and the anus, that is the perineum.
So like when you say massage it, you mean like Am I trying to stretch the vagina downward?
Just circular
It's just-
motions. Just circular motions at the skin. Don't need to put the fingers inside the vagina per se, because that can be quite uncomfortable.
Yeah, I would think so. So flannel cloth. What the heck's a flannel cloth?
Just a soft cloth.
Oh,
Like the car
God,
wash
the design,
microfiber.
Something like fiber.
but make sure you use a new microfiber.
Yeah, I have a question. So, is there instances where the vagina doesn't break at all? Or like there will always be some sort of tear?
Confirm break on lah. You see the size of a
so
baby.
my friend one never there because
Oh.
she did a pump thing.
Because I'm thinking like in the olden days, right, where they haven't learned about stitching and stuff, like
They'll
people
just
can just
rip
like
another
pluck,
fucking asshole. Right?
no, but like people can just like pluck the baby, or like
Yeah,
there
yeah.
has been cases where people are just like born at the side of the road and then
Yeah.
like
Yeah,
they
but
don't
after
need
that, the
any stitching.
vagina rabak lor, cause maybe never heal properly or get infected lah.
So you're absolutely right. In normal childbirth, especially for first pregnancies, we will often see a tear. It's not that common. It's quite uncommon to not see a tear. So that's one thing. In third world countries or underdeveloped countries where, like you said, people deliver like outside of hospitals or at home or in the village or something like that. The problem with that sometimes is the tear is so bad that it affects the anus, the anal sphincter, the muscles that help us to control our bowels and our gas. So what happens is that they're not able to control their bowels and their gas, and they just leak
Like it's a
their
long-term
poop.
issue.
Yes. Similarly
like
with
tear until the asshole.
sometimes when it heals as well, okay, it can actually affect the urinary tract as well. Yeah, so this is called a fistula. So when they have this fistula, it's called a vesico-vaginal fistula. Vesico is bladder, vagina is vagina. And fistula means an abnormal connection between the bladder and the vagina.
Wait,
and
isn't the fistula at my shin?
That's
Isn't my,
rabak, that means
my
tear is
shin
crazy,
bone
eh.
is called the fistula, no?
Yeah. And that tends to happen because labor is very prolonged in these villages. You know, they don't have access to like cesarean section. So they are in labor for 3 days or something like that.
Have you seen a asshole tear before? Like tear from the vagina until the asshole?
Yes, yes.
So how do you stitch the asshole up? Like,
all the way until the anus.
yeah,
Yes,
that's
yes,
what she
just
said.
said that's right.
So have you not been listening to the sphincter part?
No, you keep shouting fistula.
Clarify it's fibula.
No, so if you tear until the asshole, right? Like vagina, I would assume the
Then they
stitch
merge.
quite standard, right? But then once you reach the asshole, then will you have to like, cause the asshole.
You stitch wrong, you start shitting out the chibaya.
Bro, like the wrinkles now
yeah, that's
don't
how.
get ready.
You know what I mean? You know what I mean?
Yeah.
Cause like vagina stitch is just like close. But then if the asshole break, right? How you make the the to
Collagen.
Wait, why does my asshole need ridges?
no, like your
So
asshole
it's
is like
stretch, ah.
it stretches and
Wait,
then
too
it'll
many
be-
questions, too many questions.
You all got see the
Like
sodomy
when
chocolate.
Oh!
So for the repair of that kind of obstetric trauma, we will actually stitch the anal muscles first separately and then close the anal skin, the anal mucosa. So once that's closed, then after that we close the vagina. So it has to be closed separately.
asshole
Yeah.
first, then vagina.
That's
Okay.
right.
Wow. Okay.
And there are different
Yeah.
kinds of perineal tears. So, there's like first degree, second degree, third and fourth degree. So first and second degree is not serious, it's very common. But third and fourth degree, those are the ones that will actually involve the anal sphincter and can have problems. So even though there is a well-repaired, good surgical technique, sometimes some ladies just don't heal very well. And that's when they have problems with not being able to control their poo.
And most of the time, the tears are always like towards the asshole.
So in a natural situation,
Like it tears downwards.
it tears
Yeah,
downwards.
I would think so
straight
because there's
down.
a pelvic bone on top, right?
So that's why when episiotomies are conducted, at least in Singapore, a lot of
Yeah.
the times it's conducted to the side. So they cut to the side rather than cutting downwards, because you worry even you cut downwards, if you extend a bit more, it will, it will involve the
Interesting.
anus.
Okay.
But in other parts of the world, like the US, for instance, a vertical episiotomy is more common.
I would think because it looks nicer when it's healed, maybe more natural.
Possibly.
Is the skin tearing part often the more painful part of natural childbirth?
I think at that point you cannot feel.
Yeah, no, I'm thinking whether it's that also, right? Because like the pain is just so overwhelming that you don't even know it rips. Or is it the part where they usually scream out because the rippage happened?
The pain of childbirth, there are two quite discrete parts, which kind of is also a part of the delivery itself. So at the beginning, when the lady's in labor, she's having very, very painful contractions. And those painful contractions can last for many, many hours. whereby the neck of the womb slowly opens up and lets the baby
Right.
come down through the pelvis. So
That's
that
what the
is very
contraction is.
painful. Yeah, and that's why ladies sometimes say, okay, I want an epidural or something like that. Okay, and of course the epidural helps in the second part, which is when the baby's head comes out from the birth canal, followed by the shoulders, which is really the largest part of the baby's body. And that is probably the ripping part, like you referred to just now.
Right.
Babies need to
Yeah.
learn how to
Like that.
Some of my genetic bro, my shoulders.
Well, I cannot tell.
He's trying to say he got biceps.
Deltoids. Deltoids, yeah.
So I don't know whether this was from a grandma, but the consumption of the umbilical cord.
What?
Is that, yeah. Have you all heard of that before?
I've heard eat the placenta.
Yeah.
Not
Yes.
eat the-
Oh, my bad. Another grandmother, sorry.
No, but there's that also. They store the stem cells, right?
They keep,
But they don't fucking cook and eat it lah. That one is the placenta.
lah, yeah. Yeah, these two things, right?
Yeah. So actually like mammals, like rabbits, they actually eat their placenta. And that's the reason is because like in the wild, it's so hard to get nutrients. Your placenta is full of blood, iron, vitamins, and it's actually kind of part of the body as well. So these animals, because it's so hard to find in the wild, they just eat it. Like maybe in ancient times, there was no food or something, then they will cook their placenta and eat it just for the nutritional value, the protein and all that. But I think these days, people do sort of take their placenta and send it off to companies that will store it and make it into capsules for consumption. That's a thing. But there are also videos online where people are like taking their own placenta and just putting it in a pot and washing it and cooking it.
Oh my God.
So there's
Can
some
you tell me how big a placenta is?
It's like about the size of a pizza.
Oh my God. It's quite big.
Personal pan pizza.
It's
The
quite
placenta is the bag lah, that the baby
Yeah.
was in.
Yeah.
No, that's the amniotic
That's
sac.
the amniotic sac.
Huh? No, wait, what's the
Then
placenta?
what is a placenta?
Where it gets the nutrients. Oh, sorry.
So the baby actually has a cord, right, from the belly button, and there's a cord that connects up to the placenta.
The yolk sac.
No, not the same as the yolk sac. The yolk sac is very small.
Oh.
You're thinking about your ultrasound scans, right?
Oh no.
So the baby is actually connected to the placenta, and the placenta is actually attached to the mother's womb wall. So
Okay.
the placenta is kind of like the conduit, the in-between bridge that takes nutrients from mummy's bloodstream and passes it on to the baby.
Right.
Yeah, and that's why it's a very, very important organ
Yeah.
during pregnancy, because there are some ladies who have very high blood pressure. The placenta will actually tear away and separate from the womb wall, and when that happens, it's a GG.
Oh, we
for
don't
baby
want
lah.
that to happen.
We don't want that to happen.
So when the baby come out, then there is a umbilical cord that leads into the veg, ma.
That connects to the placenta.
Yeah.
to the
So how we take that second half out?
They have to
Pull
give
ah.
birth again after that to the placenta.
That's
So
right.
so after the mother chill, and then there will be another set of contractions coming in. Then we birth an organ. Is it?
A pizza size one.
Is it like this?
There's already a cord, ma.
Yeah,
so I
lor.
thought you just like wanted to.
You figure of it. You figure of it.
So you go through the whole process
Yes,
again.
Any
you
good sailor would.
push out a placenta.
no need to push out. So most of the time, mommy doesn't need to do very much. After the baby is delivered ready, usually we'll wait for about 1 minute for delayed cord clamping. So during this time, there'll be some blood flowing to the baby, right? So that ensures that baby's got a little bit more blood. Then we clamp the cord. So oftentimes daddy will clamp the cord.
Just to let us feel like we did something lah. Okay.
And then
That's
the
yes.
placenta will still be inside the womb at this point.
Yeah.
Okay, so you can actually just gently pull on the remnant of the cord and the placenta will come through.
No, but
So
you.
wait, so she's right.
I can be a gynae.
No, that's why. No, that's why I thought also. But then you mentioned when they birth that time, it already detached from the mother, and that's super dangerous. But is it not similar?
But that's after the baby's born already. What? So the baby is
No,
now breathing
before
on its own and has its own circulation.
so before is I see. I
Some
see why that's
ladies,
bad.
the placenta doesn't come out yet, and so we have to actually massage and rub the womb, and that will encourage contraction so that the placenta can come through.
Oh my god, I want to eat it so bad.
Wait, so if I'm the woman, right? Do I have
I'm
to?
so curious what it tastes like.
So if I'm the pregnant lady who just given birth,
Uh-huh.
do I tell you like, hey doctor, remember to keep my placenta?
That's right.
And then
before-
you're like, okay, and then you
No,
just
first she roll her eyes
pack
like, oh my
it
god, she's
into
one of those.
a little bag, or you wash it first and then you pass it to me.
So
is
it
it?
depends if like there's a company that wants to sort of encapsulate the placenta. Yeah, then of course they will have a courier to come and pick it up
Oh,
lah.
but-
So we have a hygienic packaging.
But
for
what if
them.
I want to like cook it myself?
Then we'll just say okay, we can put it in a plastic bag for you, lor.
Oh.
You won't want to cook it. This is what it looks like.
Yes, that's right. That's
Why
what
is
it looks
it blue?
like. I think it's partly the lighting lah.
Oh, so normally is white. Wow, it look like from the alien movies, yeah.
You look like the part that show on your face, you know?
Yeah, the face hugger.
So sometimes the placenta cannot come out and doesn't come out on its own, even in spite of rubbing and giving medicines. Then in that case, the gynae has to put the hand inside the womb, through the vagina into the womb, grab the placenta and remove it.
How far in is that? You think it's elbow already?
It can go in quite far, like up to middle of my arm.
Oh my god.
What is going on?
Is your glove that long?
It's so crazy,
As in, during this whole process, the vagina is like
Gaping.
like a cave entrance already. Like you just like go in, take out stuff, look around. Like,
Check
is-
take the
is
cupboard.
like expanded, or is it like sealed and then you kind of like push it? Like
Yeah, you have to-
go cage play soccer that you have to squeeze in.
It's a bit larger than it normally would be prior to pregnancy.
Ah.
Yeah, and prior to delivery, but it's not as large as you describe it to be.
Okay, but it's a temporary. It's like just during this period, it's like that lah.
That's
I mean,
right.
if it's big enough to
Wow.
fit the baby, you can put a hand in easily, I would think.
Yeah, but I'm wondering whether it's like closed, but then it's like it stretches out when you. put your
No,
hand
so
in,
she
or
was
it's
saying
like
that's what the
remains open
contractions
lah.
is. Part of the contraction is the hole just like widening, the tunnel widening.
Contraction, isn't that the opposite?
The vagina is an elastic muscular organ, so it can stretch and it can also contract.
So if I have twins, do I then have two cords?
Yeah, that's right. So if there are non-identical twins, then there will be 2 cords and 2 placenta.
You mean if
Oh.
two placenta?
Yeah,
It's
2
like
placenta.
Domino's one for one. Oh,
And if they're identical twins, I only have one placenta.
Depends, So some twins kind of actually have 1 placenta and they share that placenta, but they have 2 cords.
But does that mean I have a riskier pregnancy?
It is. If they share the same placenta, it's definitely riskier. And the reason is because although we think that the twins are going to be sharing the same placenta, they don't share the placenta equally. So one twin is often going to be bigger than the other twin. So people say, oh, then the bigger twin is going to be kind of safer, not so, worried about the baby, about the bigger one. But the smaller twin, if the smaller twin dies, okay, which sometimes can happen, then at that moment when it dies, the toxins will actually pass through the placenta to the bigger twin and can actually cause brain damage to the larger twin. Yeah,
Necro something, the
yeah,
condition.
Yeah. So twins is definitely a higher risk pregnancy.
But when
Is
you
there-
do ultrasound, you can tell how many placenta I have.
Oh yes, of course. We will be able to do a scan. Which is an interesting point because in the bad old days when they didn't have ultrasounds, obstetricians were taught after you've delivered the first baby, put your hand into the womb and feel around for a second baby because there was no ultrasound, so you wouldn't know whether you had twins or not.
Medicine is so hardcore.
Thank God for progress.
Yes.
No, even the ultrasound. After so many years of progress, I look at the ultrasound probe. A lot of imagination is required to figure out what's what. Like, this is your bladder. Okay,
Yeah.
like, I mean, like everything is the same. Then it's like, oh, so this is your womb. Then it's like, okay.
Yeah.
Everything is imagination is crazy.
Everything is black, white, and grey on an ultrasound scan, right?
How much of it you think is imagination? Like, no. You know what I mean? And I don't mean this in a bad way. I mean like when you say this is the bladder and this is your womb and this is your uterus, right? With how many % certainty are the doctors talking? Or is it like kinda shapely only?
Most likely.
No lah, very sure. We're
Very,
very,
very
sure.
sure.
Yeah, from the shape, from the size, from the
I always
location.
look at Dr. Janice and be like, wow, your crazy imagination. Then she will just laugh. She don't bother correct me.
Maybe last time when they're in medical school, then they put like 5 images, then they say which one is the correct one.
Which one is a heart?
Yeah,
No, you don't understand. It's a 3D, it's a 360 camera.
Huh?
You have seen a raw file. of
360.
Never.
So when they put in a probe and then they rotate it, right? You are not looking like that, It's a like that. You know what I mean? Or?
Oh.
You know, like the 360 put inside my mouth,
Yeah,
then
yeah.
I run that kind, then you
Yeah.
can see me like a small earth.
Yeah.
It's like that.
I've never seen that before.
Damn hard to see. It's super skilled to be able to
I thought you're
understand
saying
what
the
heck is
outside the gram.
I'm still thinking about the placenta and the twins.
And then you still want to eat it or not?
Have you tried it already?
No. I've never tried one.
You got any like post-pregnancy questions?
I think it's just helping women to understand like what kind of like help do they have or should they get if they have like C-section, because like the scarring itself takes very long to recover, I would assume, as compared to natural birth, for example. So like what are the precautions that they need to like take note of also?
I think for C-section moms, there are 2 arms to it, physical recovery and then emotional recovery. So physical, obviously having a big cut, maybe not really being able to navigate the wound care aspect of it being a lot more painful when getting up out of bed, like sitting up from a lying down position, finding a comfortable position to breastfeed your baby, with a wound there. The initiation of breastfeeding is often a bit delayed if you have a cesarean section because you're in the operating theatre and all that. That's one aspect of it. And then, of course, getting down from the bed and eventually starting to walk once the urine tube is removed, because we put a urine tube because it's hard for the lady to go get up and pee in the toilet. So that's the physical aspect of things. And that it already can take a toll on a lady. And then, of course, the emotional aspect of things. Sometimes there's a bit of birth trauma. Initially it was very frightening if, let's say, the baby's heartbeat was not the best and the whole team of doctors and nurses rushed in and said, we have to go for emergency C-section now. And it's so frightening to just be whisked off into the operating theatre. So that can also constitute part of the birth trauma. So I think ladies generally need a lot more time to process their experiences, and support from the family and hubby obviously helps a lot. Quite a lot of things to navigate now.
I was very surprised to learn that. So my wife had done a surgery that was supposed to be a keyhole, but she went to a quack doctor, and so it became like a C-sec scar. That's why she had like very thick keloids, right? We were very surprised to learn that should we have the privilege of becoming parents and we C-sec, right? The doctor can remove the keloid. Yeah, then give you a second chance to try and heal properly again.
Yes.
That was really cool.
Yes.
How big is a C-sec scar?
This.
Yeah, that's right. Can your listeners hear that?
6
we got
inches.
Because, yeah.
I have a question. So you know how they say like for females, right, why they have like a little, like they try to lose weight and exercise, but they have this like stubborn fat around the tummy, right? Supposedly, a lot of people online say, oh, it's because it's like your fat's protecting your organs because like females are
For the
like,
childbirth.
yeah, for childbirth. And then I always believe it was true. So I think like, okay, if I have a little tummy, it's actually like because I'm a woman. But then like suddenly I saw like a post that like shattered my worldview and said that the uterus is actually very small and it doesn't affect your tummy size at all. You just fat and have a tummy.
So what is the truth?
Yeah.
So the truth is the uterus is quite small and it will actually shrink after childbirth.
Like, is it shorter than this water bottle?
Yes, shorter. So typically, if it shrinks after a first pregnancy, it will probably go to about 9 to 10 cm.
CM? That's like this.
That's right. So it's quite small.
So the devil horn is only this long?
It's so small.
Right?
the
Wait, sorry.
fallopian-
the fallopian tubes, yeah, no. The size of the uterus from the top
just
to
the
the bottom,
uterus.
yeah.
Oh, I see.
Then
The
how about side to
fundus
side?
to the bottom. Side to side, well, that depends about 7 cm.
7? That's still... Huh,
Oh, that's
like
so
my
big.
phone.
That's so big.
Yeah.
is
So
smaller
that's
than an iPad
after
mini.
delivery.
So
yeah.
women can have abs lah.
They can. After
Wait, so
delivery,
what
do you
you're saying
mean?
is that women
Because
found
they
a
say like women,
fake
right, to
excuse to-
protect the uterus or because of the uterus, that's why your lower tummy is like most
they can't
women
get
have
rid of the
bulgy.
belly fat there lah, yeah lah.
They call it a mummy pouch.
Yeah.
Yeah, just a little bit of loose or saggier skin there.
Yeah.
And that stretched skin is fine.
It's very cute.
I heard that the women say after they give birth, then their nipple become black.
What?
Armpit also.
Who say?
What's happening?
Who said?
Who say?
Come, that's it.
Is it true?
So during the pregnancy itself, I mean, there are some physiological changes. The nipples will actually often get darker. The underarm area as well. Some ladies also under the breast area, the inframammary area, also notice some darkening of the skin there.
You mean if I lift up my boob?
That's right. Yeah. And some ladies also, even on the face, also they will get hyperpigmentation more easily. Things like melasma as well. So it's almost like old age spots, that kind of appearance.
Why?
And
But why?
It's just because of the hormonal changes. And in the tummy itself, there'll be a vertical line called the linea nigra. So there's a darkened line, and it's because of the progesterone hormones. So that's why we also tell ladies like during they may have gone for like laser treatments to their face pre-pregnancy and had no issues with that. But during pregnancy, it's probably not such a good idea to go for those high intensity strong laser treatments. Otherwise, they might actually get hyperpigmentation. Yeah, and sensitivity under the sun as well. So very common, this darkened nipples.
But
thing.
after I give birth, then it returns. The light returns.
So obviously the breast also enlarge a lot during pregnancy, right? And throughout the third trimester as well to prepare for breastfeeding. And the not only does the nipple itself enlarge, but the dark area, the ring around the nipple called the areola, also increases because that's, where all the,
Is it because the baby need to see the target? So it's darker and bigger.
that makes sense.
No, like I'm trying to think of the
It's
biological.
just something that just increase the melanin production, no
They
man.
cannot see properly, so the contrast and the size makes it just easier to find the target lah.
Then why not red?
Like maybe they see black and white first.
No, babies
They
see
see black and white first.
Babies,
they,
Am I right?
their vision is very blurry.
Okay, now we explain that. I'm kidding.
Also, they can
It's
see
just
the.
confusing. It's just all around confusing.
No, but it's true. My area.
No, tell us about the areola. Do you think areola in Latin just means ring? The length of your nipple lengthened.
Yes,
Then did it go back? Because I
I
think
think so. Should be.
I think long nipples weird me out. I think weird you out. You think you see like a long ass nipple.
It depends. I don't know.
I
How
saw
long?
I saw it before
Like-
at onsen. I was a bit shocked because I was like, "Hey, why is the lady's nipple so long?"
Yeah, like
like a little wiener size.
like that.
So like
Like
the
little
pinky,
wiener.
like a
What?
pinky, like this
So-
long.
Like a
Then I was
straw.
I was like, oh, then I saw kids there. I had to Google. Then I realized, she probably like just had children or something because
So normally it goes back to normal.
It's an anatomical variation. So some ladies actually do have a bit longer nipple, and actually that's easier for the baby's mouth to latch on during breastfeeding as compared to some other ladies who have an inverted nipple where it's kind of like drawn in a little bit, and that's much harder for babies to latch on when they want to breastfeed. So there are even things that like
So
can
those mothers
help.
usually lead to use pumps
Oh,
to.
So if it's detected in the antenatal period, actually, if the gynae does the check and realizes, hey, got inverted nipple, there are actually devices they can wear to sort of pull out that inversion of the nipple to just kind of make it evert a bit more and open up like a flower like that so that it's easier for baby to latch on. It can be a bit...
Like a
opposite of
nipple
invert is
shield.
invert.
Yeah, nipple shield also
Yeah.
can. That's right.
You
Yeah.
just paste on top of the nipple so that it creates that bump for the baby to suck
to
on.
latch on.
Yeah.
Oh.
Yeah.
Yeah.
Like a pacifier that is pasty.
Ish, yeah.
Something like that.
Cool.
Yeah.
You're gonna say you paste it, you pull
So
it.
then, so you don't feel the pain of the baby's bite, is it? Is to reduce that. That's why they call it a shield.
I guess.
Is it?
As in, like, I think it differs from the baby lah.
Some babies
Yeah.
don't latch so well, and then
Yeah.
what happens is that because their latch is very shallow, they end up biting the nipple.
Yeah.
Yeah.
Yeah, and that's painful for mommy, and
Yeah.
sometimes the nipples can get cracked and
That's why
start
nipple
bleeding.
shield helps.
Yeah, nipple shield will help with
I've
this.
never
Yeah.
heard of this product. It's a great product.
Cracked and
Nipple
bleeding.
shield.
Buy the shield.
nipple shield.
Help, Shopee link right here.
We sell nipple shield now.
Can you tell me whether breastfeeding feels like a mammogram?
I've actually have never done a mammogram
So
before.
a mammogram is an
Yeah.
X-ray of the breast to assess whether there is any abnormal lump or
Yeah, but they
lesion
do it
inside.
in the most painful way ever.
Yeah.
When
Like
they
they
clamp
suck.
it. Right?
Yeah, so
Yeah.
it's basically
So,
squeezing the breast between two metal plates. And the reason why they squeeze it so hard is because they're trying to flatten out the breast so that when they shoot the X-rays through the metal plates, then it's a bit more flattened out and you can have a slightly wider surface area so they can see whether there are any abnormal deposits of calcium which might indicate some cancer or something like that. So that's a mammogram. So it's uncomfortable, but it's for a very short period of time. The actual time of being squished is probably about 5 to 10 seconds max.
Okay, so long. Okay.
Breastfeeding is different. So breastfeeding is more of the latching part, which is quite tough. And of course, the suctioning, the suckling sensation on the breast as well. But a lot of ladies actually feel very happy when they breastfeed because there's that oxytocin
These a
release.
lot of
These are
ladies
happy
just not in my
hormones.
social circles. Everyone complains. Like I don't have a single friend that enjoyed breastfeeding. All of them like cry and then have milk production issues and the nipples crack and the
Because
baby
of-
bite. I don't think I have a single friend.
The
that is just not happy
time
to do it.
required, if they're breastfeeding exclusively, baby is really quite stuck to mummy for quite a long time. And then of course things like engorgement, where the breast milk gets stuck in the ducts, and then mastitis, it can cause infection as well. And then the breast becomes very hot and swollen and uncomfortable. So totally, a lot of ladies have this, but there are many mummies who also feel very, satisfied and despite all those.
Is it true that if you keep drawing milk, right, that the breast will just keep producing it?
That's right. The more stimulation there is, then the more breast milk production there is.
So the child can be like 24 And as long as he's still sucking on the milk, he will keep producing the
Theoretically,
milk.
right?
Oh my god.
I think up to a certain point, right? It shouldn't be for so long. But if you think about it, I mean, in ancient history, like the emperor, when he was born, he will have many like nursing, many like some of these servants who were
Nurse mums.
nurse moms. Yeah, exactly. So they will actually, just nurse him at the breast, even though he's like 9 years old or something like that. Yeah, so they actually brought people who had a lot of milk into the imperial palace or something and feed them. So yeah, it can actually continue if there's adequate stimulation.
Is it true that breastfeeding is like a natural birth control?
Only for the first 6 months after delivery. And if it's full breastfeeding, exclusive breastfeeding, no formula milk involved, then yes. And only if the lady doesn't have any bleeding during that time. No menstrual bleeding, nothing like that. But otherwise,
the body
beyond
know
that
if-
6 months.
You're not cheating on it with some formula powder. What do you mean? What do you mean full?
I mean, if it's exclusive breastfeeding, then of course, there is so much feeding on demand that's required that, there's so much stimulation that probably decreases the chances of ovulation.
Interesting.
Can you tell a woman's sex life from her vagina, from examining her vagina?
No, most of the time, no. But I did mention earlier that for ladies who have had natural childbirth for like maybe 4 or 5 children, sometimes the vagina can appear a little bit more gaping. The opening can be a little bit larger, but not always. There are some ladies who sort of say that they have delivered vaginally before, but can't tell the difference with anything else. Yeah.
I'm wondering, because a lot of people think that gynae is only in charge of childbirth, right? But you also probably see a lot of women who suffer miscarriages.
So miscarriages actually happen very commonly, as you mentioned. So about 20% of all pregnancies, that's about 1 in 5. So that's quite a surprising statistic. The thing about it is that a lot of them happen in the first trimester, which is less than 12 weeks. And at that point in time, sometimes it's a bit early, so we may not actually know the gender of that pregnancy that has miscarried.
Right.
So some ladies actually, they just have pretty irregular periods. They have periods like 3 months once, and then after 3 months, they suddenly have a heavy bleed. And they're like, 3 months of not having had a period. Of course, this time it's going to be heavier. Didn't realize that actually they are pregnant and they're having a miscarriage.
Wow.
Oh my god.
Yeah. So that does happen from time to time. And then they come to the doctor and say, hey, this time around my period is rather heavy. And then we do a check. Oh, actually they've been pregnant, but now they are miscarrying. So yeah, so that happens. And then also, if they miscarry at about 6 weeks or so, usually we don't test for the gender at that point in time. Yeah.
Right.
Actually,
So
miscarriage really still want to check for gender is a bit weird, right?
Yeah.
They get even more attachment to something that's already gone.
If
That's
you
very
have
true.
a miscarriage, are you more likely to have a miscarriage again?
If it's just a one-off, okay, and the couple is healthy and has no other, worrying, risk factors, then generally no. But if there have been multiple miscarriages, okay, so there is a condition known as recurrent miscarriages, which is 3 or more miscarriages consecutively, like one after the other, then yes, certainly, we want to do checks. Having said that, okay, there are couples who have already undergone 2 miscarriages, and every time it happens, there's so much of an emotional burden on them. And they're like, do I really have to wait for a 3rd miscarriage before the doctor will do a check? Obviously not. So they're like, well, I don't mind doing all the checks right now, even though I know that I haven't fulfilled the so-called medical criteria for a recurrent miscarriage.
What are the checks that you're referring to?
Oh, so there are quite a number of checks, things like thyroid blood tests. So thyroid is a butterfly-shaped gland in the neck that affects our metabolism. Yeah, so things like that. Glucose checks as well for, any diabetes or abnormal glucose tolerance. And then very importantly also would be an autoimmune screen. So quite esoteric blood test that is not really done in your typical company health screening. Okay, so things like anti-cardiolipin antibodies, anti-phospholipid antibodies, beta-2
Doctors just have all these
glycoprotein.
words in their head. Oh, that's crazy. Yeah. Do you look back and be like, whoa.
That's what
I'm
we
so
went to
amazing.
school for so long for.
No, I also went to pretty long,
What do you remember?
We studied
That's why I
different
go 15
things.
years, but you know what I mean?
Yeah, so things like that lah. So we check all these law, and then hopefully they come up normal.
Is there a reason why the first trimester is always so dangerous? What's going on?
It's unstable. I think it's a very early pregnancy. Anything that potentially could cause issues. And sometimes there are some pregnancies that are already abnormal, but it's hard to tell. You wouldn't be able to tell at that stage. And then initially, maybe even a heartbeat can be seen, but then after that, it just stops on its own. Yeah.
So if pregnancies make it past the first trimester, does that greatly increase the probability of it going through?
Generally, yes. But of course, it also depends on whether the pregnancy itself is intrinsically normal or not. Because sometimes if there are some very serious chromosomal abnormalities, then the pregnancy may not continue through the second and third trimesters. And sometimes even if the baby is born alive, may not make it outside of the womb.
Wow, that's so terrible.
Yeah.
It's
Because
quite
I remember when
tough
I
thing.
was pregnant also, like the first trimester was, I mean, relatively okay, but I had a lot of spotting. So the doctor had to prescribe me with like medicine.
Hormone tablets.
Yeah,
yes.
to stabilize. Then after that, past first trimester, hooray. Then after I realized, I had low platelets. So I had to keep going for like checkups.
How did you realize you have low platelets?
Because I had to do blood tests.
So nothing was wrong. You felt normal. Then you just did a
felt
random
normal.
test and then realized you have low platelets.
Yeah, and then it
Wait,
was
low platelets like not enough blood or what?
So platelets
Yeah.
actually help our
Doctor
blood to
explained.
clot.
I was helping to further
Yeah.
ask.
So there are actually some ladies who have what is called, a long name here, gestational thrombocytopenia. It's basically low platelet level during pregnancy.
Right.
So, and it just comes about and it's fine. Most of the time, no major issues. But there are some ladies who actually have antibodies or abnormal proteins in their blood that will sort of fight against these platelets. And because of that, they even need to be admitted to hospital because their platelet level will really go down very low. And we're so worried that they will have a spontaneous bleed in the brain or in the bowels or something like that. So we have to end up giving them very strong medications. They go through a lot, it's true.
For women in Singapore who are struggling with like fertility, what is the most common issue? Like, what's the most common reason that they are unable to like get pregnant?
When Pat found out that she had endometriosis, I remember we asked the doctor, why does this happen? So when they were explaining, maybe they also really dumbed down for us because we are also not very smart people, right? So they're talking about how menstrual backflows and then you have little blood cysts inside. So like, why does this happen? Then I remember the doctor just say, we don't know why. Then I'm like, Anjiao, what do you mean? Because we also realized that
After
like,
10 years of school.
so you forgot Google lah. Yeah. So and it happens like 1 in 5 women or something like that. It's just at a different severity, right?
Yes, so endometriosis is actually quite common and it's somewhat of a hidden disease. A lot of people encounter period pains and they just say, this is just something that I normally have, But actually, there may actually be endometriosis underlying it. And similarly, there are some ladies who have no symptoms at all, but they actually have quite severe endometriosis. And the first time they realize it is when they come for an ultrasound scan. They say, oh my gosh, I actually have a large ovarian cyst with, endometriosis inside. Yeah, so that is just a hypothesis, what you mentioned about the backflow of menstrual blood. It isn't necessarily the reason, or that might be one of the reasons why. Yeah, it's hormonally driven. So we do know that when ladies enter, the menopause, and stop having their periods, then endometriosis really settles. And of course, knowing that we can give some hormonal medications to help to control endometriosis.
But if by then menopause, then I'm not trying to have a baby anymore.
That's true.
Wait, can I
Yeah.
still have a baby after menopause? Is this a stupid question?
Only
I heard of all people having babies, what?
That means they never pause yet.
Yeah. They may not go in.
I think those kind of cases are with a lot of hormonal replacement therapy and sometimes overseas surrogacy. So surrogacy is not allowed in Singapore, but what happens is they could have frozen their eggs previously and then combined with hubby's sperm, but then after that they ask somebody else to carry the pregnancy for them lah.
So I got a question. So back to the inability to conceive, right? In the sitcom Friends, right? Monica and Chandler were having difficulty conceiving, and
I remember that too.
Yeah, the gynecologist was explaining that like basically Chandler's sperm was like very afraid and very weak. So then the ones that made it, right, were destroyed and butchered by Monica's very vicious and like
It's called a hostile
angry egg or
uterus.
something,
is it?
something like
Yeah.
a hostile uterus. And obviously that was like a play on their personalities and characters also.
right.
But in reality, does the person's character and temperament matter?
No. It doesn't.
It doesn't matter. Yeah. No, I don't know whether there's like some truth to it, Yeah.
No. I don't think the personality really matters when it comes to the quality of the sperm or the quality of the egg lah. In fact, for guys in general, the quality of sperm remains very good until the mid to late 40s.
Nice.
Yeah. So life is unfair. The guys tend to have a longer timeline than ladies.
I just read that like the personality thing affects the gender of your baby. So apparently, mothers who are less stressed, right, like they can deal with stress better, they are twice more likely to have girls. Because male fetuses are more fragile and they die off, while females can survive harsher conditions.
Sure, no, who right one?
I just want to say that I was very unstressed during my pregnancy.
And you had a boy! It's so bad.
How much is IVF?
Oh, sorry.
But it's whether she's stressed, ma.
During her pregnancy. Wait, does the sex of the baby is determined at the point of fertilization?
Because it's the XX and XY. You see how it's just that the way I learned it, which could be bullshit, right? You can also time your sex against the ovulation to optimize for male-female.
That is an urban myth.
So the myth is, right? The myth is that like because the sperm that contributes the female gene lasts a bit longer, right? So you all have intercourse before the ovulation period, then you let the male sperm die off first. Then you can optimize for female.
Wait a second. So if there's somebody...
But don't question me, she always say wrong. Don't clarify.
No, follow-up question. If somebody is sexually active, how much of my vaginal discharge is actually semen?
How much of your vaginal discharge is
If I
semen?
shoot inside, then it like climb up to like the
yes.
vagina.
She's talking about the cream pie. Sir, would you like to weigh in?
The sperm survives in the vaginal tract for up to 72 hours
Yeah,
after
so that after
intercourse.
it dies, does it come back out through my vagina canal?
I mean, it will
So
flow
that
out lah.
my
Even
discharge is then semen, ma.
actually, even after
way.
normal penile vaginal intercourse, when it's initially deposited in the vagina, it's kind of like gelatinous. But then afterwards, some of it will actually flow out from the vagina. So it liquefies over like a few minutes and then it'll flow out. So some ladies, like when they're lying down, they're, for about maybe 10 minutes because they're hoping to conceive. And then after intercourse, they stand up and they're like, but so much flowed out. Did it even flow in the first place? So they often ask this question, but it's because it liquefies over time. Yeah.
So but it's no indication that
Yeah, it doesn't indicate that, this time round is it's
Right.
yeah.
Because it's just the semen, right? The boys are already, the soldiers already went up already.
the boys.
It's separate, lah, correct? Or in the
both,
discharge, it
both,
also still contains
both.
like
That's
the sperm.
right. That's right.
Because there's like 70 million and you need one,
After a bit more reading, what happens is that because if it is a male fetus, the stress is more likely to result in a miscarriage, while females are more likely to make it to term. That's how this stat came about.
So boys are weaker is what I'm hearing.
Why?
Okay, if you insist. Only since you insist. Okay, so we've come to the end of this very long and lengthy episode.
But fun.
Yeah, to Dr. Serena for answering all of our questions. Like, share, subscribe, and we'll see you in the next episode. Bye-bye.
Bye-bye.
Is there a medical explanation to why our right boob is slightly smaller than our left boob?
Fuck off,
What do
really?
you mean by
No.
our?
Wait,
All of you consistently?
no,
I don't know the size.
Okay, everybody look down your shirt and turn away.
No, I've heard of this before. That one boob is bigger than the other.
No, but is it always the same side?
Wait, say again, which side is usually bigger?
Mine is my right side is a bit smaller than my left side.
No, so when you say we,
Based on
Like-
my friends, go.
do you sleep
All your friends.
do you sleep on one side,
I sleep on my left.
which is the bigger one?
So
Yeah.
I pull them more.
Yeah lah.
I don't know of any scientific reason why one